All right. Good evening, everybody. I want to welcome you to your Vitality Project, and we're here. I'm Bob Weathers, and we're here with our guest tonight, Angela McLeod. Once again, wonderful to have you, Angela.
Good to be
Hi.
here.
Hi. I see that Spencer has joined us. In fact, Spencer, you beat us to the punch tonight, and it's great to see you, Spencer. Thanks for joining us. It's wonderful to have you with us, Spencer.
Hi, Spencer.
Our topic tonight is meant to be a practical one, and it's linked into the posts that we've been featuring in the last several days, which are looking at practical ways that we can move from one modality of being. He says he was being an ass. No, you can beat us to the punch, Spencer. I'm totally cool with that. How we can move from a certain modality of being, which makes it hard for us to accomplish much, connect up with others, be creative, and even sleep. And we've been calling that the red alert brain. There's different languages for that, and we may talk about some of those languages tonight, Angela. Mm-hmm. And if we can learn to move from that with some skill into what we've been calling resting brain, it serves us in terms of compassion towards others, clarity within ourselves, staying relatively centered, certainly being creative, and also being able to complete tasks that are important to us, including sleeping. So tonight we're going to be looking at insomnia and how it is that we can take some of these skills, for example, mindfulness skills, to help calm our bodies and our minds, and maybe give us a break in terms of being able to sleep. So I'd love to speak into that with you tonight. And Angela, I do want to invite, if you care to, that we might talk some about the value that there can be in using scientific language to talk about emotional and even spiritual health, and not get too thrown off track by the fact that we're using scientific language, that there's a way that we can use that creatively. And we talked earlier today, and I'd love to maybe intertwine that in our talking tonight about insomnia, if we're able to. So I'll open the floodgates for your creativity, dear one.
Okay, thank you. Sleep, yeah, so important. And I think I can dive right into there can be, really a science of sleep. I've had a lot of difficulty with insomnia over the years, and I've even gone to a sleep lab where, they put electrodes or whatever they're called on my head to observe me sleeping, see if I have sleep apnea. Mm-hmm. And I don't, at least not in their criteria. I didn't qualify for that. But there can be so many different things that can affect our sleep. How much screen time are we using right before going to bed? There are many studies that show, that if you're in front of a screen and then you try to go right to sleep, your brain, your body is in daytime mode, Yeah. And just that the physiology of going to sleep is a progression. Yeah. And so there can be many ways to enter that topic, maybe even assess a bunch of different things in your life. There may just be 2 or 3 key things that are preventing you from getting a good night of sleep. Out of a list of maybe 20 or 30 things, you may not have to deal with every one of them. Yeah. So I've definitely looked at that whole topic a lot, and I've used the mindfulness and mindfulness of the breath when I'm laying there in bed and I'm awake. I don't want to get up. I want to see if I can make a transition. And so for me, my own experience is first trying to kind of identify what is going on. Is it a busy mind that's just churning over something? Do I feel restless in my body, or is it a combination of those things? Sometimes it's that I ate too close to going to bed. Yeah. And sometimes it's the opposite. I ate early and I'm just kind of hungry and my body can't quite relax. So these are all, different ways that we can just kind of assess ourselves kind of as a scientific approach, like look at the evidence, the data in your body and in your experience. maybe you just had a difficult conversation with somebody.
Yeah.
My housemate likes to deal with finances sometimes right before going to bed, and for me, that is not a good thing.
Me either.
And so, you know, I've kind of made a rule that it has to be at least 2 hours before going to bed
Yeah,
if we're
yeah,
going to talk about finances. So it's observing ourselves and knowing what it is that can cause that revved up red alert brain,
yeah,
which in terms of our neurobiology is being in the fight or flight mode.
yeah,
And sometimes it can be kind of on the opposite extreme. It can be in a kind of a shutdown mode, but or with both at once. You feel
yeah,
tired but wired.
yeah, yeah,
And those through the lens of the nervous system, it's like we're stuck in
yeah,
the revved up fight or flight mode.
yeah, yeah.
And so having a little bit of compassion for
Mhm.
ourselves through understanding that that we're just stuck in a mode, and then look for ways of making that shift to that calm, um, relaxed mode that we can shift
Yeah,
our nervous system into.
yeah, yeah. Really helpful tips. I really appreciate the way that you're looking at it too, is almost like an experiment. Let's just see what works. And as a good scientist would approach a scientific experiment. I think it's really valuable, and I even find it valuable as you talk about the fight or flight mode, and somehow brain and our body's biology, how that those are a part of the picture, right down to talking about, for example, the effect of screens on our nervous system and our circadian rhythm of feeling like, is it daytime or is it nighttime or what's going on? I will insert here, if it's okay with you,
Sure.
Angela, our conversation today, which is Angela and I are both very interested in different scientific approaches that have relevance to, among other things, managing stress and increasing resilience, and how various tools are germane to successful, sustained sobriety in the
Hmm.
conversation about addiction recovery. And one of the things we were talking about is that looking at addiction and recovery scientifically, for example, talking about the biology of self-regulation, doesn't negate talking about addiction and recovery in other languages as well. We might well use psychological language or spiritual language. There are just multiple roads to understanding the complex beings that we are in general, and certainly that applies specifically to talking about what addiction is and what it looks like. I, for one, much prefer to cite research that's been proven to be effective or diagnostic or whatever. I do that not because I think that that's the be all and end all of addiction recovery, but because I think it's going to be a very helpful language. You and I talked about it today. I think that talking about addiction and recovery scientifically can help give clients a leg up in terms of being able to step back from over personalizing addiction. The typical move down through the ages around most emotional and behavioral struggles or even disorders has been demoralized about them. And so to make the person bad if they had anxiety, or make them
Yeah.
evil because they're depressed, and certainly with addiction, and with the evidence that we have in the last century, and especially the last 20 or 30 years with brain scan technology, it's clear that there's a medical perspective on addiction that can be very useful. Do I think it's all of what addiction is? No way. But if
Yeah.
it can help people to step back from judging themselves or judging their loved ones to a more objective perspective, then I'm all for it. And you and I talked about it today. It almost becomes its own mythology, and I don't mean to step on anybody's toes with this, but by mythology, I think of the way that Joseph Campbell, the great mythologist, talked about myths. He says he believes that people will say that myths aren't true. He says he thinks myths are truer than what most people think is true. I feel that around the mythology of psychology or the mythology of medicine. And I don't mean that disrespectfully. I mean, can we find a language that has traction and meaning that can aid people in a very kind of concrete, practical way. And I think that talking about the nervous system the way that you do gives people an in to talking about what's going on in their bodies and their brains. It can be very useful. You and I were talking specifically about this, and I could tell you stories too. Right before we met right now, I was on the phone with somebody who's coming out of a treatment center here on the West Coast, and we were talking about addiction and recovery as he ponders the transition back into his normal life. We were talking about it from multiple metaphors, including looking at addiction biologically. What would be required to manage stressors in such a way that he's less prone to relapse? And I think that that's really valuable. I also think that talking about addiction recovery spiritually, in terms of meaning and purpose and value and ritual and prayer and meditation, I think all of that's valuable too. So I got this from you years ago. I love your both and inclusivity, and I hugely adhere to that. Is that more, not less, is needed in terms of let's embrace as much diversity as we can when we talk about addiction and recovery, including the hard sciences, including the humanities, including dance and drumming. All of it's pertinent, it seems like to me. So that's my Magna Carta tonight about this topic. I'd love to hear your thoughts about this, because I know that you're equal parts artist and scientist yourself, in terms of your respect for scientific evidence that's coming out just daily right now, out of the work around nervous system regulation, and at the same time that we're talking to you in a dance studio. So
all of this. I'm just right with you with this whole holistic perspective of integrating anything that works for us. And not leaving anything out, that could be of help. For me, my own passion about the science of the nervous system was that didn't start just out of the blue, just because I thought I wanted to start studying something like that. I noticed this huge shift in my own experience of myself in a day-to-day way after a number of months of practicing Qigong. And I also noticed when I was around certain people where I would find myself becoming more calm, because we had a trusting relationship that that I felt this trust in. And somewhere right in there, I became introduced to how the nervous system, when we're stuck in fight or flight or freeze, collapse, we don't have access to compassion. We see the world in terms of what is going to be threatening to us. It is hard for us to have a spiritual experience or to be creative when we're living on a survival level, when we're worried that something is going to kill us. And that is also difficult for relationships. An example I have is that just the other day, I went to my housemate and I was sharing some exciting news, and he seemed very flat and uninterested. And I interpreted that as, oh, darn, he doesn't like me, or he doesn't care about me, or I'm boring. I'm bothering him right now. And then I paused and I realized I know him very well. And we're talking about the nervous system and how we can be in these different states. And I realized, he's overwhelmed right now. He's in that shutdown mode. He can't take anything else in. And as soon as I recognized that, I shifted to, I felt compassion. I no longer felt like I was a problem to him. I no longer judged him and felt pissed that he wasn't listening to me. And that's just one small example through the doorway of the lens of science, where I could sort of understand our nervous systems and how that brought me into compassion, which isn't about science at all. That's about my heart and my relationship. And so that for me is a little example of how we can weave all of these things together. They don't have to even be consciously woven. It's just, if you allow yourself to have it as a resource, why not? Why not? And that it can be a part of our whole spiritual experience as well.
Yeah, yeah. As I'm listening, I love what you're saying, and I appreciate you bringing in the personal example, which really kind of roots it in our experience. What occurred to me was the phrase that you and I shared together today: "Science in the service of compassion."
Yeah. Yeah.
I've always felt this way about psychology. Through my whole career in clinical psychology, and I've always felt like that psychology is, this is the language I've used for it. I feel like the psychology is the handmaiden of spirituality. Is the
Mm.
goal isn't just psychology and let's not be screwed up psychologically. It's like, let's be all we can be. And I think of spirituality in its broadest form of providing a big enough space to encourage us to be the individuals that we were born to be. I see that as fundamentally spiritual. And if psychology can be in service of that or be a handmaiden to that, I'm honored to do my little piece. And I feel very, very much so that science need not be divorced from spirituality or divorced from compassion. In fact, it's in service of compassion. And this is a perfect example of it. Your understanding afforded you enough space to respond with empathy rather than judgment or contraction. And that's a huge gift, it seems like to me.
Yeah. Yeah. And I really would love to just point out that there's a lot of evidence, scientific evidence, that many of us who struggle with addiction,
Yeah.
and who are sober and still are struggling
Yeah.
with things like trauma that's unresolved,
Yes.
with depression and anxiety. Those are biggies, there may be more. But when we can look at that through the lens of the nervous system, and we can look at it through other lenses as well. But in the nervous system lens, we're in a chronic, in depression, we're in a chronic shutdown, withdrawal mode, shame mode. With the fight or flight, with chronic anxiety, we're in this constant state of agitation, fight or flight. That is not something you can live in minute by minute, day by day. And no wonder it's a driver for addiction. And so if we understand that for me again it shifted me from feeling like, oh my God, there's something wrong with me, I'm a bad person, I'm stuck with this for the rest of my life, to realizing, oh, this is my nervous system. There's a big part of it that's my nervous system. And now there's some things I can do with that. So it's empowering as well. It's not the end, because there's things to do. There's still things, actions to take, practices to do, spiritual work to do. But when we can weave all of these together, then we have a bigger chance of staying sober and thriving.
Yeah, yeah. Really love what you're saying. Very touched by it, Angela. Very touched by it. Is that here's what was coming up as I was listening, is that alternate languages other than moralizing about addiction, other than shaming addiction, those languages are afforded us in for example, the language of biology, the specific language you're bringing tonight, or the language of psychology. And so those languages help to unshame us, to destigmatize us. That's a plus. And also, as I was listening to those languages, those technologies, those disciplines, they also supply skillful means that we can practice to aid with our depression, aid with our anxiety, aid with our PTSD, aid with our addictive behaviors, and so on. And so that it serves multiple functions. The language takes me off the hot seat of judging myself or being subject to other people's judgments. And I'm also given a leg up in terms of strategies for how I can maybe get at the root. If anxiety is what is feeding, I've shared this with you before. I remember an RN that I saw years ago said that, Bob, none of us can barbecue in our own adrenaline. And for some people that will move into depression, just as you were saying. And for other people that might move into anxiety. It's not sustainable for anybody. And as soon as I get that, how can I possibly continue to judge people that are vulnerable to addictive self-medication of anxiety or depression? It just begs the question, what can I do to have a more parsimonious, direct, almost like a scalpel? How can we get down to the heart of the anxiety that underlies the addiction? How can we get down to the self-esteem issues? How can we get down to the depression? It's like I think, it feels really important. I'm remembering slides from public presentations I've given where one slide just says shame paralyzes, because I think it does. I think it does. And then the next slide is information, good information frees. And I don't think it's sufficient. I think we need skillful means. I think we need, whether that's therapeutic interventions or recovery practices that we sustain over a period of time, but certainly it gets us started in the right direction to have good scientific information, it seems like to me. So yeah, I'm really right with you, quite inspired by what you're saying. Spencer's with us, and he just wrote, he loves being here. Thank you, Spencer. I do too. We're going to wind down in just a minute, Angela, but I'd like to give you the final word. Or maybe you have a friend there in your dance studio that would like to give a final word.
I do. I'll bring my friend in, but I want to say that you're using the language of the red alert brain and the resting brain, and I love that. I love, we can have as many terms as make sense to us. And I do want to also acknowledge that I often use the terminology fight or flight or freeze mode. And those are both part of the red alert. Those are survival mechanisms, you know, and the calm, safe and calm mode, you know, it's kind of like the resting brain mode. But since you talk about that so often, I want to show that they are parallel. They're really talking about the same thing.
I agree with you. I have to tell you the story, you guys. Angela and I met earlier today, and we were doing a meditation. And included in the meditation was to focus on one another's space. We're both in our office space right now. And I looked over, and to Angela's right, right off of her shoulder, was something that was way off in the corner. I couldn't tell if it was some ancient Persian statue or maybe a skeleton. And I told her I got tickled when I saw it, because I think of my grandkids with Halloween coming up, and it turns out that that's quite an amazing skeleton. Angela, just for the sake of those that are watching, because they'll be in such suspense, can you please tell us how and why that skeleton is in your possession?
Sure. My dear? Yeah, this is not related to Halloween for me. My background in dance and massage therapy and all kinds of movement work, I'm fascinated with the body, and I'm studying the nervous system. And so I use this when I'm talking to people, and I want to show that the vagus nerve comes out from the base of the skull and goes down into the throat and into the chest. You know, it just helps you get a visual picture for a lot of different purposes.
Yeah. That's beautiful. I'm glad for you. Do you have a name for your, does your friend have a name?
I haven't named this one. So if you think of something, let me know.
But, I think that he or she could well become a fixture of our Friday nights together.
Sure.
I want to read something that Spencer sent to us just as we're finishing up here. It's a beautiful quote. The quote is this: "Those who judge will never understand, and those who understand will never judge."
Oh, that's great.
Beautiful. Yeah. Thank you, Spencer. I appreciate you joining us. I want to thank Angela for being here again this Friday night. I appreciate all that you brought. I really appreciate this piece that we brought in about inclusivity of languages and complementarity of languages. It's beautiful, and we'll continue in this spirit. Please come back every Friday night. Angela and I are here every Friday night. Really appreciate you deeply, Angela. Thank you.
Thank you.
Yeah. Wish you a beautiful evening and weekend, Angela, and all of our listeners too. Have a safe weekend and a restorative and nourishing weekend.
Sleep well. Pleasant dreams.
Sleep well. If you haven't read today's post, look it up at Vitality Project about sleep, and it gives you some practices that you can use even tonight. Good night, Angela. Take care.
Bye-bye,
everybody. Bye-bye.